You are on mute, Dr. Raleigh.
Good afternoon and good evening, everyone. Can you believe it? We're in December and we are counting down to the end of the year. Can't believe that. My name is Dr. Carolyn Rowley, and I like to say hello and welcome to our We Care Mental Health and Suicide Prevention Part 2. And if you remember, if you were with us, we did a part one with Dr. Lori Vick and myself, and we heard Bring It Back. So we're back. But this time, we're back with Dr. Lori Vick and Pat Corley. But first up, I want to actually just say thank you. For those of you who have been with us for the entire year, for all of our programming, I want to say thank you. Thank you for trusting us to bring you all these different mini seminars and Arthur's Corner, our educational summit, Hispanic Heritage, Arthur's Corner, and then our Wednesday webinars. Thank you. We appreciate that. And we're thankful for being able to actually serve the sickle cell community in the capacity that we do. And so, again, thank you. We want to wish everyone a very healthy and a very safe holiday season, a healthy and a safe holiday season. However, we do know that this can be a rough time for many folks. Many of our warriors do feel isolated and alone at times. And then for some, it can be anniversaries of a lost loved one. And so we know that that can be difficult. Either way, we want you to know that we're here. We offer many services. So, in addition to our support groups throughout California and transportation, we also offer free mental health because we know that it can be important to be able to speak with someone. And so that's what we're going to be doing today is we know it can be difficult, but we don't want anyone to be in a place where you feel that this is just it and there's nothing else. So, with that, I'd like to bring up Dr. Lori Vick and Nurse Pat Corley, and they can be brought up. Thank you. And so, two lovely ladies, um, doing this with Lori Vick last year was the topic, of course, was somber, but it was wonderful. Her professionalism and just the amount of information she has. And of course, our wise one, Pat Corley. Um, she's our wise sage person. And so I'm going to turn you into trusted hands while Dr. Lori Vick and Pat Corley speak to you about mental health and suicide prevention in general, but particularly with sickle cell disease. Ladies?
Thank you so much.
So thank you, Carolyn, for making it possible for us to share with our community information that will help to empower them and to help them to better navigate life with sickle cell disease. And so, without further ado, I'm going to have Dr. Lori Vick speak with you about suicide, and mental health. So, Lori,
Thank you
it's all
very
yours.
much. Thank you so much. I appreciate you, appreciate all of you, and appreciate the audience for the time that you're spending with us. And I have to say, I was so thrilled when I heard Dr. Rowley talk about the mental health support that's offered. So, what a wonderful thing, so important. I would just like to ask Ms. Sharonda if she would go ahead and bring up my slide presentation, and we will go ahead and begin. We can, you see what our title is, it's been mentioned, so if we could just go to the next slide. So Pat and I have both identified that neither of us have conflicts of interest. I do need to share with you that I've been funded by the National Heart, Lung, and Blood Institute, and in that funding, I was able to do research to find out some of the content that I put into this presentation. However, I am totally responsible for what you see here. These don't necessarily represent the views of the National Institutes of Health. So thank you. Next slide, please. So our agenda will include some definitional things. And I guess I need to back up. I'm a teacher and an educator. And I shared that with you all last year. I prepare people to become nurses. And so this will sound a little nursey. I just have to be open and honest about that. But also, I need to share with you, I come from a place of compassion and caring for individuals and people, and in particular, people with sickle cell disease. So this is kind of an enmeshment or an intersection of all of these things. So I'm going to share with you definitional things. We're going to have some general data and statistics. We're going to talk about mental health and mental illness and sickle cell. And we're going to talk about some reports that people have shared with us, both in the research realm and then in our personal lives. And there'll be some resources, and then we'll have a brief summary at the very end. Next slide, please. So I always share this because my background is strongly in the mental health community. Many, many years ago, a doctor named Brock Chesholm, who was the first director general of the World Health Organization, said, without mental health, there can be no true physical health. And to me, that has always struck such a strong chord, because if we are not mentally well, it's very difficult for us to care for our physical needs. And so I share that with you right out of the gate. Next slide, please. So this is, I utilize a resource called the DSM, or Diagnostic and Statistical Manual. And this is the 5th edition. And this is how they define, and actually the criteria for how they would diagnose someone with depression. So to get to the nitty gritty of it, if you know someone who appears to have low mood most days and also has some of these other types of things going on, I encourage you to support them in seeking out some of the services that Dr. Rowley talked about. So some of the things we're looking for: feeling sad, feeling empty, the hopelessness when people communicate to you about being hopeless or feeling like they're worthless. And that's what we see in the adult population predominantly. In children, they manifest this depression in a different way. Children and adolescents and young adults, they may become more agitated or irritable. You might think that they're misbehaving, that kind of thing, but we need to look at what is behind behavior, whether it's a child or an adult. I've had individuals that I've been providing care with present themselves in a very hostile way. Anytime I see that, I'm going, what is behind this? There's always something behind behaviors that people wouldn't normally exhibit. So those are some things that we need to take a look at. In children, we see weight loss. In adults, we can see weight loss or weight gain. When people have excessive sleepiness, they say, I just want to sleep, or I want to sleep my time away. I just don't want to wake up. That is a warning to us that we need to look further into this, not just as a care provider, not just as a nurse, but also just as a family member or somebody that you see this in somebody that you care about. You can also have what they refer to as insomnia or hyposomnia, a lack of people being able to sleep. So they may be up for excessive amounts of hours. We also see psychomotor changes, and that just means physical movement, that they're really slowed down. It's just like they could hardly get moving. They stay in chairs for prolonged periods of time, or laying on the sofa or laying in bed, just don't have that energy to get out. And then the next one is not having energy, or anergia, so how we refer to it in the clinical environment. And then the big clue is recurrent thoughts of death. If people are talking to you about death, if they seem to have more focus on things having to do with death, obituaries, anything that makes, has a reference to death. And then the open and frank communication about having thoughts about ending their life. I don't just mean harming myself. I mean ending your life. When they say to you, I don't want to live anymore, and I'm thinking about ending my life. And they talk about the various ways that they might do it. And then much more concerning is when they make the attempt. So these are the ways that diagnosticians, providers would look at these different bits of information and determine this person is experiencing some type of depression. Okay, go to the next slide, please. And Miss Pat, if you ever want to interject, please just do, okay? Thank you so much. Okay, so, and then suicidal behavior, it's a specific type of disorder, and it's defined as a self-initiated sequence of behaviors by an individual who at the time of the initiation of those behaviors believes that this would lead to their death. So suicide is ending one's life. It's defined as death caused by an intentional use of force directed at oneself. And I know that that's probably pretty clear to all of us as we listen to this and think about it. But I just wanted to have that out on the table. This is not something that I tiptoe around. It's something that I'm very straightforward with. And I ask the patients or the individuals I'm interacting with, do you have thoughts of ending your life? I don't say, do you want to hurt yourself? Do you have thoughts of ending your life or killing yourself? I know that sounds harsh, but that's the communication that needs to take place so we know what action we need to take. Okay, the next slide, please. So what we might see are some concerning things, the risk factors. If a person has ever attempted suicide before, we know that that puts them at a much higher risk. It's at the top of this list. That means it's the most important. If they have family members that have committed suicide, there is sometimes, well, in all mental health disorders, if somebody has a family member that has that mental health disorder, we have found the family members of that person may have a higher likelihood of having that same issue. And when families see other family members use suicide as a way to deal with whatever their situation is, it is really modeling to the others in the family that this is the way to manage this. So that's something that needs to be discussed as a family or as a provider working with a family. If a person is in the acute phase of any illness, depression, anxiety, substance use disorder, any acute, even severe level illnesses like schizophrenia and bipolar disorder, those individuals are more likely. People who suffer from chronic pain disorders, this makes them at high risk for suicide. Pain is so intolerable, and I know I'm preaching to the choir, but there are lots of pain disorders. We know how significant it is in people that have sickle cell disease. That's why this is a question we must ask. And then we evaluate people with different instruments, and one of them is called an ACEs scale. This helps us to look at trauma-related events in children, but now we are also finding out we need to be doing this same thing in adults. People that socially isolate. So that was brought up by Dr. Rowley, talking about people being isolated. I cannot emphasize this enough, especially since the pandemic occurred. I have listened to people talk about how they've had family members that have committed suicide since the pandemic because the social isolation pushed them over the edge. At least that's how they perceived it. We already spoke about hopelessness, so I don't need to go on again there. But people also experiencing overwhelming stressors, and financial is a big one. When I go into a little bit more data, we're going to look at information about how men in particular, when they lose their jobs, there is a feeling of they don't feel like they're accomplished. They sometimes lose their self-worth associated with the work that they do. It's not just a man thing, but we do see this in male populations. Another is individuals that get into financial situations, financial distressing situations, like people that have gambling disorder and borrow money, trying to what I refer to as robbing Peter to pay Paul, that kind of thing, trying to catch up. When people have significant financial issues, it can become overwhelming to them, and it can become a reason for them to be at high risk. And then there's the biochemical or the neurobiological. There is a whole group of medications that are available called selective serotonin reuptake inhibitors. Those are the medication groups that are helpful to people that are experiencing depression. So we know neurobiologically there is a chemical reason that some individuals become very depressed, and then also puts them at a higher risk for suicide. Next slide, please. So warning signs. If you see this in your family member, please reach out. Threats or references to death and suicide, sharing with you the hopelessness that they feel, them withdrawing from you, or demonstrating nonverbal behaviors. I'm always very concerned about people that are going out and buying weapons that have never had them before. Watch for people that are stockpiling pills. There's all these things that we need to tune into. Individuals who are increasing their substance use. Some people will use the substance as a way to end their lives. It will disinhibit them and they feel like they can take the action. If they report being a burden to other people, I don't want to burden you. I don't know how many times I've heard that in patients that feel like they're burdening their family. Their hearts would be broken for you to harm yourself because you thought you were a burden to them. There's great love. Yes, we know that the work can be onerous, right? It can be difficult, but the love is there and you're not a burden. I just have to say that you're not a burden. Also, people that take on others' burdens and others' debts, they're doing that with some type of intention. I have a friend who took on the debts of his family before he decided to kill himself. So that's a real thing. This is something that I've experienced in my life, and I just want to share that. When people start to give away the things that are meaningful to them, now, sometimes we do that as we get older because we want to pass things on. So you have to kind of ask the question, based on age or based on that individual. But people that give away their prized possessions, ask the question. What's going on? Why are you giving away all of the things that you hold near and dear? Are you thinking about ending your life? Honestly, when I say that to people, they tell me, I'm so glad you asked. So now I can tell somebody about it. I needed to talk to somebody about this. Mm-hmm. The cluster behavior or the copying, we see that a lot more in young ones, in junior high and high school. They'll see somebody that uses suicide as a way to cope, or they even make pacts, agreements amongst themselves to do this. It's a very rare thing, but it is something that happened in a neighboring community where I had lived previously. Sudden changes in behavior or mood, or people being unstable in their mood with a lot of variability, a lot of flexibility from angry to happy to and everything in between. One thing we share with all of our parents who are taking care of children and adolescents and young adults, when they start on a medication, an antidepressant medication, we are obligated to share with them, monitor your child for suicide. The medications help to improve the energy level of patients who have experienced depression for a long period of time. And unfortunately, they get the energy to take the action. So it's really important to have open communication between parents and adolescents and young adults that are taking medication for depression management to make sure that your child is safe I just can't say it any other way.
So, Lori, I know sometimes in situations where there are parents who are fearful about discussing these kind of things with their young children or young adults, and so they avoid talking about whether you're thinking about harming yourself or whether you're thinking about killing yourself, because they think that if they start discussing it, it will put it in the head of that person, and then they must do it. And so, what kind of things can we suggest when that kind of situation arises?
This is such an important thing that you say. So I have now been doing this, sharing this information with people for like over 20 years, close to 30 years actually. And I have never had a situation where I put it in somebody's head by asking them the question. And I've asked both the question and I've asked the individuals, did this affect you? How did this make you feel when I asked the question? People share with me their experience is they're glad that I cared enough to ask them. I want to reassure parents that if you ask your child, are you having thoughts about ending your life? That might be a little easier to say than killing yourself, right? Are you having thoughts about ending your life? You are not putting that in that child's head. Children that are thinking about suicide are thinking about it on their own. They are aware of it, they've heard of it, and they're feeling like they don't have other ways to cope. You asking the question gives them an opportunity to talk about it. And if you have any concerns whatsoever, get them into some place to be seen immediately. Suicidal ideation and suicide attempts, unsuccessful attempts, are an absolute reason for inpatient hospitalization and full-on support for that individual. Does that help, Pat?
It does help. It does help, because that's always a concern when I talk to people about whether they should even bring that up, because it might get stuck in their person's head. And so, yeah, that was really, really helpful.
Mm-hmm. Yeah, no, this is a very common concern. And so we just, we want people to feel absolutely feel free to share what their concern is for their child's well-being. It means I love you and I care deeply. Because think about what it takes for a parent, a grandparent, a family member to ask that kind of question of you. That means you're really digging in deep, and you want that child to be able to express themselves, or young adult. That's typically the group that we see and we have the big concerns about. I should not say it's the only group, because suicide happens throughout the lifespan. So it's the question that we need to ask everybody, but I understand the precarious concerns of a parent with a younger child or teenager. Next slide, please. Okay, so some information. So I looked at data all over the globe, and a lot of this data is coming in like 10-year increments. So they're looking at like from 2011 to 2021. So this is kind of that time frame. And so thinking about that number of people dying from suicide around the globe, what I found interesting was the stuff in this slide. Suicides occurring more commonly on Monday, the first day of the week, and the first Monday of the month. And what does that kind of stuff say to you, right? What's happening the first Monday of the month, or the first week of the month? Bills are coming in. If somebody loses their job and they can't make their bills, these are the issues. The other two things here are the times of day that I found interesting. Morning to midday more frequently, but we can also see in peak suicide level in the nighttime. And they also share in the data that the time of death depends on the age. People of different ages choose different times of the day to take their lives, which I thought was very interesting. And I was absolutely certain before I did this data search that Christmas would be the time that people would be the most distressed. But it's actually New Year's. And the reason it's New Year's is because that's when people get to start all over again. It's a new year, right? And we think about all the things that we're going to do. The sad thing is that people that feel very depressed feel there is no new, no better, no opportunity for them in the new year. And so they decide that that's the time. So the highest time for suicide is on that New Year's Day. And then decrease, the lowest time is on Christmas. I thought for sure Christmas would be the time, right? Because we hear about how people feel so sad at Christmas. We know that there's a lot of grieving that goes on during the holidays for various reasons, for people that we've lost in the past, for things, having a kind of fond memory about what it was like for us at another time in our lives when we were young, when we were raising children. You know, just think about the milestones of a lifespan. And then when those things are no longer happening, that may bring some sadness to an individual. So anyway, that I wanted to share that with you all just to kind of keep in mind.
So, Lori, those who attempt suicide, who are unsuccessful suicide around New Year's time, has there been any conversation with those individuals to share why they felt like that was the absolute best time for them to commit suicide? Was it because they felt like they didn't want to burden their families with another year of what they were going through?
It was a lack of hope. It was a lack of hope for the future. They didn't see a future or a renewal time for them. That's what I read. There is more to look at. There is a lot of data, and there's a lot of research that's not been done, particularly with people with sickle cell disease. We need to do more. But what I was able to identify was that it was truly just being so depressed and not feeling like this is my new year, I'm going to grab and that renewal time didn't apply to them, and that was really tough. That was tough to read. Okay, next slide, please. So I wanted to share with you what is happening in the United States. And the darker the blue, the higher the suicide rate per state per 100,000 persons. So this is a 2021 time frame. Again, I think they're looking at like 10 years of time, but this is what we see. And, you know, we think California, large number of people, right? Texas, large number of people. Florida, large number of people. But when I look at Pennsylvania, I thought, there are several large cities in Pennsylvania. And so, but this is the data. So I just wanted to share that with you. So my hope is in these states where they have large numbers of people, there's large numbers of resources because they're going to need them. I have to share that in the past 10 to 15 years, there's been a big decrease in mental health resources. And a lot of resources that were once present have gone away. So it's my hope that as we are determining by what we see evident in our country in particular, and in our individual states where we can have more impact in the communities, that we are advocates and allies to support people that are experiencing mental health disorders, and that we do more and do better for them than closing down what is available and the support sources. I will share a brief thing that is personal, but yet specific to this issue. I lived in the middle of the country and worked in a large psychiatric facility for a number of years. The facility was closed down. The people that were in the facility were moved out into community things. And while I love community living and individuals having their homes and being able to be as independent as possible, the services that were associated with that inpatient, extended inpatient environment were no longer available. What I saw as a consequence of that was increased death notices of the people I had taken care of in the psychiatric facility before. And so I don't believe we would have seen that had they not been sent out into the community and removed the services that were there to support them before that. So I just want to share that with you all. And we absolutely need to do better. Okay.
So years ago, Lori, and I can't even remember what year it was, when in California, all of our state mental health hospitals were closed down during the time that Ronald Reagan became president.
Mm-hmm.
And since that time, because I was heavily involved in working in mental health during that time, since that time, I've seen such an abundance of homelessness and mental illness in California and in other places. Those regions particularly were moved a less area that was difficult to live in to California, where it was pretty sunny and it was warm a lot of the year. We saw a major increase in mental illness. And I'm just kind of wondering if, somehow the closing of hospitals have made a real difference in increasing hopelessness for people who commit suicide or who have major mental health issues.
Mm-hmm, mm-hmm. I think there's a lot to unpack there, Pat. I agree. I have never seen the homelessness issues that we are seeing today, at the level that we're seeing it at. This is like unbelievable. I live in a southern state. I'm in South Carolina now. And, we know that people come from the north to the south when it gets cold weather, but there's a large number of people that are, they need a lot of help and they're homeless and they need mental health support. And I think I didn't look at the data on this, so I really can't speak to it, but I suspect that there are high numbers of people with mental health disorders in our homeless population. And I don't think that's too far of a stretch for me to say that. Yeah. Okay, next slide, please. All right, so both of the prior slide and this slide are both from the Kaiser Family Foundation. And again, they were looking at a 10-year time period, 2011 to 2021. And the things, I apologize, I'm going to take my glasses off because the print's super small. But I wanted to look and see what the difference was in African Americans or Blacks. And what I was able to identify and what I'm sharing with you here is that in 10 years, there's been a 58.2% increase in suicide death rates in Blacks or African Americans. Now, this does not say sickle cell. This is just looking at African Americans or Blacks, right? And then when we look at the age group, that 12 to 17 is alarming to me. We're talking about children. And you see that high level, 47% increase in 10 years. And I have students that I work with in the college environment, and they have literally shared with me in the past that they would love it if I created a course that was about coping, helping people to cope, developing skills of resilience, which we've talked about in the sickle cell population. This is very alarming to me to see young people in such need. Okay, and that's what I want you to take away from this. The number of African Americans or blacks and the number of American Indians and Alaskan Natives, it's phenomenal. And then the young people. So really we could look at the 12 to 17 and the 16 to 25-year-old groups as having had significant increases in the past 10 years. And you got to ask questions of the data. What does this mean? What has happened in the last 10 years to cause this increase? Does this have to do purely with population increases, or are there other variables that we need to explore further? So that's the work that we have to do. Next slide, please. So I wanted to share this with you. In the past week, I was so intrigued to see an actor. His name is Courtney B. Vance, and this is the front of his book that I pulled off of a website because I've ordered the book now. And I took some time to look at some of it. I haven't gotten the book yet, so I only got to delve into part of it. But I so appreciated what this man had to share. So it's Courtney B. Vance, an actor who many of you have probably heard of. And then he's working, collaborating with Dr. Robin Smith. And they've written this book called The Invisible Ache: Black Men Identifying Their Pain and Reclaiming Their Power. And Mr. Vance shared in an interview that he was in just this past week that his father committed suicide. And he had to work through that. So I'm not putting anything out that he didn't put out in public, right? But I think that what he shared was that his mother really strongly encouraged and supported him and his siblings in receiving counseling support, in receiving therapy and the things that they needed to help them understand and to cope with. And I think that's what all human beings need. If we're experiencing some type of mental health disorder, it's not all about the drugs that we take, although the medications may be important. But I think people need support from other human beings to help them process and work through. Find that person that you can connect with, that you can communicate with, and receive the support and care, compassionate care that you need. And when I heard him sharing that, I thought this might be a book of interest to the community. And so I just wanted to share that.
So Lori, thanks for sharing that, 'cause that's amazing. And you talked about that age group, 12 to 17. And I can remember as a young person, my mother died when I was 13 years of age. And my first thought was I needed to be with her. You know, it wasn't comfortable here. Though other people loved me, the person who loved me best was then gone. And I can remember there was no mental health services available at that point. You know, you just talked, to whoever you talked to, or you just sucked it up and dealt with it, And I just think that probably even years ago, our suicide rate was probably pretty high, but it really wasn't evaluated well, and particularly in the sickle cell community. I had clients who actually committed suicide, who had sickle cell disease. One jumped out of a car on the freeway. Another one's father hung himself because he thought that he had been diagnosed with cancer and he didn't want to suffer like his son with sickle cell was suffering. So there's a lot of things that happened to people. He was later, his family was later told that he didn't have cancer, that he was gone already, And so I think it's so important to understand the significance of really getting the help. It doesn't mean that you're crazy because you have, you're feeling not quite yourself or not normal for what you think is normal. But it's just really, really important to seek help and realize that you can feel better if you get the help that you actually need.
Mm-hmm. You know, I'm looking in the comments, Pat, and I just took a look at that, and there's something I want to share from that. But before I do, what you have shared with us, I think, is absolutely amazing. Thank you for sharing what happened to you personally. And then also thank you for sharing experiences that you've had with people that had sickle cell disease, because both of those things, the personal experience and the lack of resources and just how you felt, I'm 100% sure I've come across people that's been their experience too, when they've lost somebody that was so dear to them. It was like losing a piece of themselves and they didn't know how to go on. You know, I've heard that before. It is a human thing, very human. And so I don't know how you got through it, but I'm so glad you did. And to think about the people that you knew that took their own lives also, I hope we can learn from them. That, I guess that's my way of trying to figure out what's the next thing. How do we learn from people's experiences to do better and help one another? So I hope that's what's happened for you, that your experiences helped you to help others because you knew what you felt. And then when others are feeling those hard things, then we find a way to dig in and try to make a difference in others' lives. So thank you so much for sharing that. That's all so powerful. There is someone in the comment section that said, what about a parent with an adult child as well? So I want to go back at that, and I apologize I didn't see it sooner. And could you tell me a little bit more about what your concern or question might be? So I'm not quite sure. I need a little bit more. Tell me more. I'll wait for you to come on. We'll go on to the next slide. And when I see you come back and give me a little bit more info, I'll try to respond, or Pat might be able to respond. Okay, so this is information about sickle cell disease and depression. So we understand that sickle cell disease is the most prevalent genetic disorder in our country. We know that depression is a mood disorder, and it's associated with neurochemicals, and I've identified those. And we know that pain is associated with sickle cell disease, both the acute and the chronic. And that pain and the pathways for depression have some common ground. So that's what I wanted to share with you about that. I am just completely in awe of people who are living with sickle cell disease and day in and day out demonstrate their strength and resilience in spite of managing living with this. And my hat's off to you, because I'm getting older and I have aches and pains, but it's nowhere near what your experience is. And I just think you have so much to offer and teach us about how we can help people and do better and work well with you. So thank you. Next slide, please. So I looked at some studies that they had done, Al-Salman and others, with people that have sickle cell disease. And in that 2022 study, they found that 50% of the study participants had depressed mood and were in a state of depression. And this is what's significant to me as a nurse and a person working with people in clinical environments. When people are experiencing depression, they are more often in the emergency department. They're more often and longer in intensive care units. And also, they identified that there was an increased frequency of a need for blood transfusions. I don't know exactly what the connection is, but these were the data and the facts that they found out. We also were able to determine that the prevalence of depression in people with sickle cell disease has been overlooked, and that we are not doing the best job that we could in identifying early and treating and supporting to positively modify disease severity. So when we see that people have depression, or I'm sorry, when we see that people have sickle cell disease, if we're not evaluating them for depression and anxiety and other mood disorders, we're missing something that's important in their care. We're not looking at the whole person, and we need to do a better job of that. Next slide. So this is looking at depression worldwide, 350 million people. 21 million adults in the US have had at least one major depressive episode. So that's about 8.4% of the population. 8 to 25 have the highest levels of depression. 15 to 34, suicide is the second leading cause of death. This is horrible, but that's just the facts, and I wanted to share that with you. Next slide, please. So I suggested that we needed to do a better job of screening. I am not a primary care provider. So that means I'm not a medical doctor. I'm not a nurse practitioner or a physician's assistant. Those would be individuals that do assessment and could be doing screening in their practice. What I am doing now is preparing nurse practitioners, physician's assistants, and medical providers to encourage them in the depression screening of people with sickle cell disease. I have the good fortune to be able to provide education to providers. And so there's these two instruments that are super easy to use. The Patient Health Questionnaire 9, it's 9 questions. It's very quick. The Beck Depression Inventory Fast Screen, again, less questions, very quick. I've looked at a couple of studies, one that was done by a dear colleague of ours, Coretta Jenneret, and the other one was done by Edwards et al. Anyway, they identified that when they screened people with sickle cell disease, 29% indicated a previous episode of suicidal ideation. That's in the Edwards study. And 8% have attempted suicide in their lifetime. That is a large number of our small population in the US of people with sickle cell disease. So, and to me, one person is too much. I mean, it's heartbreaking. It's just so hard. In this second study that Dr. Jenneret had done, they identified 29.1%. So we're seeing about the same thing. Nearly 30% of people with sickle cell disease are also identifying that they have depression. Not necessarily that they feel suicidal, but there's depression. Okay, so the next slide, please. So this is Dr. Jenneret's data. And you can see here, that number again, nearly 30%. So the ones on the left, they did not meet the cut score for having depression. The ones on the right, but if you look all the way down that line, we're looking at about 50 some people out of 179. That's a large number of people that you could do the screening on and then refer to treatment. Next slide. I have a friend who has been working in psychiatry for a long time. And we have a colleague who works in the cardiovascular space. And it was very interesting to me that our dear friend in the cardiovascular health space said whenever people have emotional or psychosocial or mental health problems, that individual is not too comfortable with it. So if you have providers that you have identified may be great in the hematology aspect, but they're not screening you for depression, ask them to do it, or ask them to refer you to somebody that can help, right? So not everybody can do everything, and that's okay. Our hope is that you have excellent care and you get good comprehensive care. That's what this is all about. Okay. All right. So this next group of slides is going to be about resources and thoughts about resources. So I keep thinking about hope. So hope is a desire combined with an expectation. And I ask you to think and meditate about what gives you hope. Where do you find your hope? And if anybody wants to reply to that in the chat, I would love it. What gives you hope? And then resilience, the capacity to withstand and recover quickly from difficulties. And Pat shared with me tonight, the resilience of the people she's met with sickle cell disease is just phenomenal. So for those of you who have withstood so much, share with us how you do it. If you put something in the comments section or in the private chat, whatever works best for you, please do share. We would love to hear from you. So think about what gives you hope. Meditate on what gives you hope. Where do you find it? And how have you survived and done so well with so much adversity in your life? Okay, let's go on to the next slide. When I see stuff, I'm going to talk about it. Okay, so I've identified all of these things as positives and as resources. Purpose to me is a resource. So a purpose is the reason for which something is done, a reason for something being made, and a reason for something to exist or someone to exist. So please meditate and think about what gives you a reason for living. What gives you that purpose? Someone has down, I am a 55-year-old warrior. I get hope by working hard to get financially independent. Thank you so much for sharing. I know you're working hard because you just told me you're a 55-year-old warrior. So, all right, I got you on that. Absolutely.
She's a 55-year-old warrior with a doctorate in education. She's working hard.
You know this person.
No, I'm just looking at what she's put up there.
You're reading.
You know, the hardest thing for me with having so for those of you who don't really know me, I started off in sickle cell 100 years ago when they first started the first 10 sickle cell center of excellence. And the hardest thing for me was talking to clients at that point, and people had magical numbers by which you're going to be dead. And so from the time that people with sickle cell disease were very young, they were dealing with the realities that were imposed on them related to how long they would be living and what kind of things they would be experiencing, and then the isolation from family members and stuff as a result of the person getting sick every time something was planned or something. And so I think that when we talk about suicide and when we talk about depression and health issues, we have to really unpack all that luggage that is packed for people with sickle cell disease very early on in life and packed for their families in regards to how they're going to live their life with sickle cell disease. I always say that people with sickle cell disease are the most resilient people on this planet because they go through a lot of things, and yet we have people like the young lady who just posted that she's 55 years old, has been to school and is living disease, and she finds hope and pushing forward. So I just think we have to kind of think about how we can the scenario of imposing all of that baggage on people with sickle cell disease. How can we do something different from what we've been doing in terms of provision of information to people and their families with sickle cell disease? Because I think it has major impact on how people perceive their lives or their desire to live with sickle cell disease.
Well said. Yes, Dr. Rowley.
Thank you. Um, this has been some powerful information, everyone. But I did want to share, to piggyback a little bit off of what Pat stated about doing things different. Many of you probably heard my story of Bobby. Bobby, 18 years old, who decided he was done. And I think what's devastating for me that an 18-year-old said, I'm done. And part of his being done was not being seen, long waiting times, not being believed, and suffering and not being believed. And I'm sure it's just not in the sickle cell community, but I think being misunderstood is a area that many people can attest to. It doesn't feel good to be misunderstood, and to some degree, you feel invisible, and that you're nowadays they call it imposter, but you're not trying to be, you're just misunderstood. So, Pat, when you said, so what can we do differently? Particularly in this whole 21st century where we just had 2 FDA approved gene therapies. So the science is like going way to Mars, right? But we still are here in the thick of it where people are still not being heard, not being misunderstood, and they want relief, whether it's financial relief, pain relief, emotional relief. And so, what is it that can be done differently? Can we just give grace to people a little bit more? We say that often, but can we little grace to people? Because we don't know what when we don't do that, what they're left with, who they go home to, if anyone, and they're left with these feelings and thoughts. So, we always talk about love on one another, but there's some people who don't have another. So what can I really would like to hear from the audience, what can we do differently? We've heard these stories. I shared with you about Bobby and how he allowed his body to just atrophy. And so he died. I'll call it passive suicide at 18. So what can we do differently? Well, I think, Dr. Lori, you're doing it. You're educating folks. Um, I think if we continue to educate the providers, that's great. If we continue to educate the parents, that's wonderful. If we continue to educate ourselves and each other. But I would like to hear what other people have to say. What can we do differently? Because we know, I'm so glad that we are stating these ideas again, these comments, these statements again, these facts. But what can we do differently? Just to kind of piggyback off of what Nurse Pat said, what can we do differently?
So let me share some things in the chat with the comments.
I see.
Can you see them? I'm so grateful to see. Well, first of all, the young woman that spoke first, she says that she's been out of work for 6 months, and this feeds into her depression and hopelessness. So that really speaks to what can we do differently? And you saying show grace, but what supports would be important and help this person. And then also sharing about having 2 daughters that help her to dig deep, to hang in there. So finding that purpose, right?
Definitely. And I do want to say this too, Lori, Dr. Lori, that we invite people to reach out to your CBOs that have resources. They may have financial resources, and if they don't, they may have social workers that can find some of those resources. Okay. Being out of work, I would love to know what you do. Let me know what you do, because those of us, there's always contract work, more and more these days, um, particularly with a lot of things, a lot of buzz, what's going on. And so let us know what you do. Um, don't just use Indeed, but let the community know what your talents are. And so perhaps we can actually use that on a per diem or contract basis. So please, please, please let us know.
And
I'm glad
and
that you're hanging in there for your daughters. Thank you for hanging in there with your daughters.
and
Seriously.
then to share, Carolyn, there are at the state level. I know California has a state Department of Voc Rehab that will retrain people to do other jobs if they can no longer find work in their area. And so for us to dig in deep and do some research on the state level and on the city levels to see if there are programs available all over the country that might be able to benefit people living with sickle cell disease in terms of re-educating or redirecting their careers in a way that can make it more meaningful for them. Because we all know that with sickle cell disease, it's a great interrupter. You know, everything is going well, and then all of a sudden, something happens and it's no longer going well, you know. And then to just increase awareness, even on the doctor level, so that they better understand what people with sickle cell disease actually experience, what they go through, the depression they feel, sometimes the fatigue related to being severely depressed, not able to even get out of bed. So important for us to make sure that others understand, because others are very quick to judge people with sickle cell disease. And many times they judge because they just don't understand sickle cell disease and how it shows up and shows out in instances where it actually makes people with sickle cell disease no longer want to move forward, but want to just give up and feel like there's no hope. So I encourage us to really look more deeply at what we can do as community-based organizations, as people within hospital institutions, on the state level, on the local level, on every level to make a difference. And where there is nothing, maybe we can better at creating some of these things that might better meet the needs of our population in terms of dealing with mental health issues, dealing with suicidal ideations, and moving up the ladder to ensure that we give people exactly what they need rather than judge them because they have sickle cell disease.
And Dr. Lori, Etta came back and talked about her question. So she went, if you want to read her question.
Yes, yes. Thank you, Etta, for coming back. So, and thank you for providing more clarity. I see exactly where you're headed with this. So, my first thought is, what are you seeing your adult child doing? So, have they shared with you that they're having thoughts? So, you're saying here, my question was, when do you ask your adult child who are thinking about suicide if you see any signs? So, if you see some of the signs that I described, giving away their prized possessions, what do you see in terms of their medication? Are they taking medication consistently? Are we stockpiling meds? I'm a firm believer in asking the question. Ask your child. I love you with all my heart. I need to know how you're thinking, how you're feeling. Are you having thoughts about ending your life? And while that might be the hardest question a mother could ask a child, it's also the most important question that you can ask your child. And you do this from a position of you're my baby. I love you with all my heart and I want to help you. And so any parent or any loved one that goes at it with that approach, that individual will see that you're compassion and caring for them. And it is my hope, but I have to be honest, it's not always going to be perfect. We hope that the child will feel comfortable enough in sharing. What we can do if they hold back and you can sense that, get them to somebody that they can talk to, someone that they do trust, someone that they would be willing to let the whole story out. People have thoughts going through their heads sometimes that whirl around in the most horrible ways. And we just need a moment to think through it, to process through with somebody else. And to hear someone say, I get you. I can understand how this can be so confusing. It sounds like you're going through something really rough right now. How can I help you? How can I be there for you? People need to hear that. They
Yes.
need to have you listen to them. And we have to do this with love. Really, that's what it is. I love the work that I do, and I care deeply about people, and that's how I deliver myself. Right? I deliver myself, and so my hope is to help. And when you present yourself in that way, as a mother, as a caregiver, as a friend, people recognize that.
Yes.
They know it. They know you for your true self. I hope that helps.
So the answer is just, sometimes you just have to ask. It's as painful as it may be to that person that you're asking, it also is painful for you to have to ask those questions. But they're necessary questions that need to be asked. There's no way of getting past asking those questions, and so I encourage you to sometimes you just got to suck it up, be brave and ask the questions, and be prepared for whatever answer you get, because most of the time when parents finally get around to asking, they already know the answer to that question. They've seen their person suffering and giving up on life and not achieving the way they achieved before. And so for those of us who see that, sometimes we have to just be brave enough to step up to the plate so that we can actually give that support. And as you talk to their healthcare professional, one of the things that I always talk about with healthcare professionals is that oftentimes when they see clients, they never ask those kind of questions. I mean, you only given a certain amount of time, I know, to see that client, but one of the most important questions that you can ask surrounds depression and how you're living your life with sickle cell disease. And so I would say to you, as family members or people living with sickle cell disease, encourage your provider to ask those kind of questions, because sometimes you may be so down and out that you don't think to share it, but it needs to be shared, because there are things that, services that you can get to help you to live better with sickle cell disease and to get past some of the depression and some of the hopelessness that you experience as a result of having sickle cell disease. So just to say, sometimes we have to be that person who may be left feeling hopeless or helpless ourselves sometimes as we deal with people with sickle cell disease. I tell people that I have seen patients suffer because no one ever asked those questions. Nobody ever offered them services that might be beneficial to them. And so I encourage those of you who may not be healthcare professionals or who may be parents or friends or whatever, to actually help people with sickle cell disease to look more closely at, I think a lot of people with sickle cell disease think it's normal to feel depressed. It's normal to feel helpless and hopeless. And what we do can really make a difference to help them to do better with what they're going through and experiencing.
If I could add another thing, I remember, Pat, you shared, so a lot of things are shared on Facebook. And sometimes they don't share, a person doesn't share their name. And so because Bobby was 18 and it happened, it almost felt like it came back again because Pat had stated that someone on Facebook was sharing that they wanted to die. So what was heart-wrenching for me is that there was no way to identify who the person was, but they obviously were reaching out. And so that's actually very challenging and as you stated, the person who's feeling this way, they really don't want to. It would be nice to be rescued. It'd be nice for somebody to get it. It'd be nice for that situation or whatever to change. And so they do reach out. So it was very heart-wrenching when Pat shared it, because it's like, so what do we do? There's no identifiable information, but I believe that the community, gave some support, according to Pat. And so I think that's all that we can do at times is let them know, call us, reach out. We'll walk you through to the mental health person if you don't have someone, or we'll just listen. Sometimes people just want to be heard, and then we can figure it out together. But it's really not the answer. So this is the anniversary of, if you all remember Twitch, this is that anniversary that it happened just a year ago, that he didn't have sickle cell, but he was in our community. So that was absolutely very devastating. And this is an anniversary. So to all of you out there who are hanging in, thank you. We really do. That's why we do what we do. We really want to hear from you. Contact us. And I'm sure that the contact information will be at the end, where you can reach out to Cayenne Wellness Center, Suicide Prevention Center, your nearest CBO, CHW. We really do want you to reach out. We really do want to hear. So I just wanted to just share that because it is an anniversary of something that occurred last year. Thank you.
Okay, wow. So I'm going to go into the comments again. What I noticed was some really wonderful things that people were sharing also. Community support is needed. We need to believe in warriors. I love that, believing in warriors. I think that's so important. Being a part of something bigger than yourself helps me. I think anytime we help another person, that's that bigger than ourself moment as far as I'm concerned. I know this is going to sound kind of like a cliche. I apologize about that. But a long time ago, I was watching this program, and someone said something about when you're loving somebody else, you're loving God. And I thought, oh my goodness. So I just, that strikes me. And I know that, has a religious perspective, and I don't know what everybody's comfort level is with that, but that's a value of mine. So if that works for you, wonderful. Let's see, there was a couple of other things.
And I did want to just mention to everyone, so we have about 10 more minutes or so, and we do this for you. And so I appreciate Dr. Vic for her slides. We do this for you, though. So share with us your thoughts, your feelings. I like the question that Dr. Vic raised about the hope. And I think we did show Carly's her response. She says, knowing that I have talents can help others in my community gives me hope. I think that's a great thing. Let's focus on what does give you hope. What does give you hope? What does put a smile on your face? And how can we encourage you to do more of that, whether in the sickle cell community or in an area that you have passion for? So as we wind down, so I think this is time for Pat and Dr. Lori to, as we wind down, I do have a special something that I want to share with the community towards the end. But as we wind down, did you all have any thoughts that you wanted to leave the community in this tender period? And I say tender because I was listening, Dr. Lori, and you mentioned for facts that it tends to be highest the first of the month, first of the year. And I was driving, so I couldn't hear the other ones, but first of the month, first of the year, this is a tender period. Do you all have any words of wisdom, thoughts, comments that you'd like to share?
It just means to me that we need to be more vigilant at this time.
Okay.
If you have any loved ones or people that you're aware of that are isolating more and demonstrating those behaviors that we need to be mindful of and watch out for. This is that we're moving towards that time of the year. I mean, New Year's is just a little over a week and maybe 2 weeks away, not even probably that long.
Yes.
So I think we need to pay attention. That's my word of wisdom. Let's pay attention to those people that are struggling, and we know they're struggling.
Yeah.
Let's not look away. Let's keep our eyes open and our eyes on them and let them know that we care and that we're there. And remember, I said we can't be all to everybody, but we can at least be a support and get them the services or the support that we need. It's an honor for me to be here and share time with you all. I'm grateful to be asked to come back for this year too, and to be with all of you here. So thank you so much.
Thanks, Dr. Lori. Pat?
I guess what I'd like to share is that I know a lot of people don't seek mental health care because they're afraid of what other people think about them. It doesn't mean that you're weak. It doesn't mean that you're less than. It doesn't mean that you haven't done everything you can do to be successful. It simply means that at this point in time, you might need something that lifts you. And the other thing I want you to remember is that when you see somebody for your mental health services, anything you share is secret. No one else has the right to any of that information. The only time that they would be sharing that information is if there were threats on someone else's life. But otherwise, your information is private. It's just your information, and your person who's providing that service will not be sharing it with anybody else. And the third thing I want to share is that you are worthy. You are deserving. You are wonderfully created. And even though you may be at this point not feeling at your best, tomorrow's another day, an opportunity for things to be better for you. And so I encourage you to seek whatever care you need in order to feel better at whatever given space you're in right now.
Okay, wow. So that was good. I was just trying to think that you're right. Mental health now, going to counseling is like the new thing. So it's no longer, oh my goodness, you're going. It's like, you're not going. And so You're not in the in crowd. Because and that's what I'm hoping it will happen that you're just not in the in crowd if you're not going talk to somebody. And so I I encourage you all, and it doesn't even have to be anything heavy. You know what I'm saying? Sometimes it can just be you have to make a decision about jobs, about relationships, and it doesn't have to always be heavy, but it's really nice to not have to wear out your friends and to have someone who's neutral, who's this is what they're equipped for. And so I want to hear more of that, you guys, next time. We're going to do a part 3. And so we're going to have a raise of hands. How many people have been or going to therapy? That's a good thing. So I encourage you. Thank you, Nurse Pat, for that. Well, wow, we've come to nearing the end of our very last for 2023 webinar. It's been an awesome year, and we have a lot more to come. And I look forward to that. But this is what I need to say. So I've shared it already last Saturday. I'm sharing it this Wednesday. We actually have a special gift that we're going to be mailing to the one and only person who's come to every single one, every webinar, every mini seminar, every author's corner, every virtual online or summit or Hispanic seminar, everything. You all know by now who that is because they're on. She's on all of them. The one and only Etta Carter. Please, you all, give her a round of applause. Give her her hand waves. And so we will be sending her. I mean, that's support. So even if I want to feel, if I get a little tired because we're very busy, but I can always count on. We have at least one supporter, and that's Etta Carter, and it makes me smile. And so we will be sending out something to Etta. You're going to get something as a show of just thank you. Thank you for trusting what Cayenne Wellness Center does. And so, hey, everybody, we encourage you. You can join Etta, and you can invite a friend and attempt to be able to come to all the programming that we do. And so
you can actually invite as many friends as you want to.
Exactly. And so, Etta, and you're right, Brenda says Etta supports so many of us. I know. So I'm encouraging others to give her a round of applause too, the other organizations. But she is going to receive something special from us, and we're very, very happy about that. She'll get a certificate and a honorarium. I think she's going to get our Cayenne water bottle. And Mary, you have to help me out. What else that we said that we were going to send to her? So thank you. All right. Wow.
Wonderful. Wonderful.
Of course, this is being recorded. So if you want to listen to it again, you want to share with your community, this is something that you don't want to miss, I encourage you all to do so. So the entire team at Cayenne Wellness Center are partners and speakers like Dr. Lori Vick, and of course, our wise, sage person, Pat Corley. We thank you for being here, spending your Wednesday evening, afternoon with us. Please be safe. Seriously, please choose that. Choose health, mental health, physical health, nutritional health. Choose that. Choose to slow down. At our mini seminar on Saturday, I forget who said it, but she says we don't even give people applause for taking their out of office day. We kind of want to keep working, folks. And so for those people who say, I need a break today, I need to take a nap, take care of yourself. We applaud you. We applaud you. We want to support you. So take care of yourself, everyone. And please be safe. And if you are feeling any kind of way, you just need to talk. I don't know if we have a slide for our just the end, but I can just tell it to you. It can be in the chat. You can info@cayennevolunteers.org. That's us. But there's also the Sickle Cell Prevention Center. And so, Dr. Lori, if you have that number, can you put it in the chat and the team will share it with everyone? We do want you, if you are feeling that way or someone else is feeling that way, please have them call the Suicide Prevention Center number. So that's going to be coming really soon. There we go. 988, very easy, 988. So from all of us, our community health workers they work really hard, they're compassionate, our entire team, the tech team, wait a second, 610, hey, you guys know that 610 rocks. You all know that. 610 Design rocks all the time. I'm going to use what Pat said, they show up and show out. And so we're thankful for them. Of course, the one and only Mary. And so Mary behind the scenes, who's calling you all to become speakers, and calling and texting and emailing. Thank you. Everyone, but particularly the warriors, the caregivers. I have some other news. Good thing I have 2 minutes. I have some wonderful news, you all. This is about mental health, right? Okay. Do you know that we just received funding for another year from CPS for mental health? Hey now. I just received that email that we have funding. Did you hear me? We have funding from CVS for another year of mental health, meaning that our mental health is free to the community, but it's not free to us. CVS has showed up, showed out, and they are providing us funding to continue for another year for free mental health. Seriously. That's what hard work is about. When it finally comes through, oh my goodness. Okay, don't let me get pimped.
And so the other thing is, know you guys are all valued. We value you. You are important to us.
Yes.
Yes.
You know,
Yes.
this community is amazing. But it wouldn't be nothing without you.
Yes. Seriously. And so with that, I think we're at the time. Dr. Lori, thank you. Have a safe holiday.
You also.
Pat, thank you. Everybody here, thank you. 610, thank you. Cayenne, everyone, all of our supporters, thank you. And we are out for 2023.
So long, everybody.